Hello， 大家好，欢迎来到洛杉矶华人咨询网的直播现场，我是主播莉亚。在现代家庭生活当中啊，生育压力呢是一个逃不过的话题。那有些家庭呢，因为一个小婴儿的诞生，要做出无数次的努力，但是呢，可能最终都没有结果。那这个时候呢，可能您就需要去咨询 IVF 了，也就是生殖辅助技术，那俗称的就是试管婴儿。今天呢，我们非常荣幸的邀请到美国著名试管婴儿 IVF 专家，同时也是 HRC 生育中心的主席 Dr. Willcox。Dr. Willcox 在辅助生殖领域呢，有着数十年的经验。他荣获了多个医学奖项，也被誉为是数千个中国不孕家庭的救星。他所担任主席院长的 HRC 生殖中心被美国 Newsweek 新闻周刊评价为是美国最佳的生育诊所。那在本期节目当中呢 Dr. Willcox 将会为我们讲解华人夫妻的生育难题该如何解决，用他这么多年的经验呢，为大家来现场答疑。Hello, Dr. Willcox. It's an honor to have you with us today.
Hi, Leah. Thank you very much for having me, and hopefully we can talk about things that are interesting to people interested in fertility.
Sure. Could you please start by introducing your career as an IVF award-winning physician, and what has been your motivation over these years?
Well, my career started actually in San Diego. I went to UCSD for undergrad and got a biomedical engineering degree. Never thought I'd be an engineer. It was a pre-med program, and I graduated and went to Los Angeles to do my medical studies. I graduated from USC and then did a fellowship in OBGYN and reproductive medicine. Wow. So it was a long ride. I finished when I was about 33 years old, and my first job out of my fellowship was HRC Fertility. I've been here now 27 years. It's been an amazing career. Had the opportunity to help thousands of patients and been able to experience all the changes in our specialty over the years. And thankfully been in one of the largest markets in the US, one of the most successful markets, and one of the most successful programs in that market. So it's been a pleasure to have the experiences that I've had, and hopefully I'll continue to do this for a long time.
I really have a really thorough explanation. Thank you so much. So when it comes to choosing a fertility practice, what factors should a patient consider? Do you have any advice for our viewers, especially for Chinese American community?
Yeah, I think there are a couple things you need to consider. The most important probably is the physician. When I think about a fertility doctor, I think the things that come to mind for me are you want somebody who's really honest. There's not always a great opportunity to tell people things they want to hear. And so honesty to me is a really important part of what we do every day. We're not always the most popular, but we need to be honest. I think you also need to be generous as a physician. You need to recognize that when you go through fertility treatment, most of these patients are paying out of pocket, and there are a lot of hardships. Sometimes things don't work out exactly the way you like, and I see it as sort of a joint venture. So you want a physician who's going to be invested in you and is going to make every attempt to help you complete your journey. We also want somebody with a strong work ethic. I mean, the bottom line is you didn't pick a specialty that allows us a 9-to-5 job, weekends off. You're going to work 7 days a week, 12 hours a day, and you need a team around you that's willing to do the same thing. So we are definitely a subspecialty in medicine that has to work pretty much every day. Last thing is talent. You need somebody who's talented, right? But once you've chosen the physician, then you really need to find a practice, I think, that has all the facets that we can do today in fertility. And it's gotten incredibly complex with the ability to do day 5 transfers, genetic testing, single gene analysis. We're looking at the possibility of doing full gene sequencing, which is really here already. You really need a program that's going to have all the opportunities for you to maximize the chance for success. And then I think the longevity of the center, you need a center that's going to be around for a long time because people are freezing their eggs, they're freezing their embryos to have babies in the future. So I think those are the 3 things I would think about when I'm looking to choose a fertility center.
So at what age do you recommend patients to consider the IVF treatment, and how likely is it for them to succeed on their first try?
So truthfully, men are lucky in the sense that they just continue to make sperm throughout their lifetime and have incredible fertility. Unfortunately for the female, we know that they're born with all of their eggs and deplete them as they get older. And with genetic testing, we've learned to appreciate that it just gets progressively harder to get healthy embryos. When you do genetic testing, you'll see the ratios of normal to abnormal will progressively decline as women get older. So we usually tell patients, if you're not thinking about having a baby before you're 38, I would strongly recommend freezing eggs, or now, we're freezing embryos for couples that are happily married but not ready to have kids, and they're eclipsing that age at 38. So between 35 to 38, if you haven't had any children, I strongly recommend that you consider freezing embryos or freezing eggs. As far as success, that's pretty clear with genetic testing, that if you can produce genetically normal embryos and the uterine lining is normal, the uterus is normal, which is true for most women, the implantation rate are about 60 to 70% for normal embryo.
Okay.
So it doesn't usually take too many tries to conceive. 90% of patients are pregnant within the first 3 tries. So the key is just getting to these patients while they're still fertile and still creating healthy embryos.
Got it. So given the number of Chinese patients you have treated, like what unique needs you have observed among Chinese couples, and how are they different than American families, particularly in terms of psychological, emotional, and lifestyle choices treated to IVF?
Well, Americans love children, no question about it. But I perceived a significant difference in 2013, 2014, when we first started meeting a lot of patients from China. This was when the 2-child policy was starting to change, or the 1-child policy was starting to change. And we were seeing patients come for their second baby. And it was incredible how the patients really felt entitled to have that second child. And it was really emotional watching these patients work so hard to overcome the obstacles to try to have that second baby, which, often meant coming to the U.S. Sometimes we had to use an egg donor because they missed the opportunity to have a baby with their own eggs. But ultimately, we were able to help thousands of women from China that were just given the opportunity for the first time in decades to have a second baby. So it was pretty emotional for me and my team. And, we made many trips to China, been to all the large cities. We got an opportunity to meet a lot of people. And they were just incredibly generous, wonderful, loving people that were so excited to have children. And it was really inspirational to me to get to see that.
Yeah, I can feel that because I'm the only child in my family, and my mom just loved children, and she was like, if she could have this chance, can have a second baby, and she would do that. But actually, the second child policy was not just open to her while she still have the fertility ability. So it's kind of like regret for her. So thank you so much for helping these people, and also in traditional thoughts, infertility treatment often carries a stigma in China, leading many to suffer in silence and maybe causing strains on family relationships. And how do you shift these perceptions? And what does your clinic do to provide support?
It's interesting. We saw the same phenomenon. I've been doing this long enough where fertility was relatively new in the U.S. and it wasn't adopted like it is today. A lot of people felt that there was something wrong with the woman. For whatever reason, it was more focused on the female than the male. And there was shame associated with having to go through fertility treatment.
Yeah.
I can tell you that that's changed dramatically in the U.S., partly because many people that we treat today don't have fertility. There's nothing wrong with them. They just want to extend the reproductive window. They want to freeze their eggs. They want to freeze their embryos. They like to use a surrogate. They like to do gender selection. So these are all patients that we never treated before. And now they're seeking fertility. So now it's widely accepted in the U.S. to come to use fertility to help enhance your reproductive experience, right? Shorten the duration for pregnancy in some cases, or achieve all those goals that we mentioned. In China, I am seeing a difference. I'm seeing a change, thankfully, as I think people become more familiar with these other options, and it's not necessarily associated with shame. It's not associated with having a problem, to have to seek a fertility specialist. But we do see some situations where people want to be very private about using a surrogate. I do think part of that has to do with the legality of surrogacy in China. Yeah. It's not widely available, right? And in the U.S., we don't have those issues. It's minimally restrictive in the U.S. So we can help people achieve their goals, whatever we need to do. For the most part, we can offer them, which is unique to the U.S. Not true for a lot of European countries, and certainly not true for China. So we do see a lot of patients coming from China that need egg donation, surrogacy, or gender selection, and we're happy to help those patients.
Great. So there are definitely some misconceptions about IVF. Some people said, the worries about the healthy of IVF children, and how do you educate your patients regarding this matter? And could you please share some technology advancements in IVF right now that may benefit international parents, especially for those people who are from China?
Yeah, I think, it wasn't intuitive that you could grow a baby outside the body and have a healthy child, right? So early on, we were very concerned about any kind of manipulation that we did to the embryos. Even intracytoplasmic sperm injection, where we inject the sperm into the egg, was a real concern for really decades here in the U.S. Thankfully, the body of evidence supports that IVF is quite safe. As we all know, we hit the 1 million babies born mark, many years ago. Throughout the world, and it's widely accepted in most industrialized countries as a wonderful resource to help people to conceive. When you look at the data, there's still some controversy. There's appears to be no increased risk of major malformations. Those are the major birth defects that we all worry about. But there may be some controversy about whether there's an increased risk of mild malformations. And the baseline incidence is around 3%, and maybe a little bit higher with IVF. That's still to be determined. Very difficult to measure something if it's a very subtle impact. But I think the consensus overall is that it's extremely safe. It's a reliable way for couples to have babies or have families. Today with genetic testing, we've taken it to a whole different step, right? So we've been able to do recessive gene screening for hundreds of genes. Before you ever have a baby, you find out if you and your spouse have the same mutation and potentially are at risk of having a baby with one of these sometimes catastrophic recessive gene disorders. And we also have the ability to do the analysis for the number of chromosomes. Most people have heard of Down syndrome, but there are lots of different conditions that usually result in miscarriage, right? Virtually every type of abnormality you can think of is not compatible with life. So miscarriage rates are often impacted by the baby being genetically abnormal. So not only can we reduce the risk of having a baby with, say, Down syndrome or a recessive gene, but we can lower the risk of miscarrying by doing genetic screening before transfer. So I think we've answered that question pretty well, that IVF is a safe way to have a baby. And that's why I think we've seen so many couples using IVF that don't necessarily have the traditional infertility issues.
Got it. Just curious, I know that people can choose the gender, but is there any genetic selection as an option? Can I choose other things for this specific baby? Because you said the genetic text really can, learn a lot from it, and maybe we can make some options on one baby.
So, the technology is definitely going to be here before we're ready for it. The bottom line is that's been true for just about every major advance in reproductive medicine. It takes us time to understand the ethics of what we do, but we're about to embark on doing full gene sequencing for the embryo, which is incredible considering there's only a few cells that we're analyzing. There are roughly 30,000 human genes, and if you think about assessing every single base pair of the 46 chromosomes, it's mind-boggling. That we can do that. And that's the next major step that we're seeing in genetic screening. And that gives us the opportunity to look for de novo mutations, right? So these are spontaneous mutations, which are very, very rare. Most have an incidence of about 1 in 17,000. So it's not something we worry about often, but it's catastrophic if you were to have a baby with one of these missense mutations or spontaneous mutations. But we're going to be able to screen for virtually, increased risk of conditions, and that's going to be a big breakthrough. And as we learn more about what each gene does and how it influences the end result as far as longevity, health, intelligence, height, you name it, it's going to be an ethical dilemma how we manage that information. But it's happening. We're definitely able to do full gene sequencing, and we're definitely going to start with major medical concerns. But those people, who are inclined, maybe start using that technology to do other things. But for right now, our focus is just trying to have healthy babies and do everything we can to reduce the risk of having any major disappointments for the couple when they're going through fertility treatment. You want a healthy baby every time, hopefully.
Got it. So many couples may prefer, traditional Chinese medicine and believing that it may enhance the fertility naturally. And in your professional view, does this really help the pregnancy? Or are there any risks that people using the traditional Chinese medicine may delay the decision, to pursue the IVF treatment?
I think the consensus today is that they work hand in glove, right? So Eastern medicine has tremendous advantages over traditional medicine and vice versa. So I think that, at least our approach is if the patients are open to using acupuncture or Eastern medicine, then we definitely encourage it. And there's data in the literature to support that there may be improved outcomes. You have to understand that the acupuncturist can spend a lot more time with our patients and provide a lot more support for our patients and help them through the entire process. So, medicine's, it's not always clear cut how the benefit occurs. But at the end of the day, we're working together to try to make sure we get the best outcome. What I wouldn't encourage people to do maybe is just focus on, Eastern medicine or focus on Western medicine. I think it's healthy if you're open-minded to look at all possibilities, all avenues. The nice thing about traditional medicine or Western medicine is that we've got the scientific method that has been the major, source of making progress, and that allows us to have clear-cut outcomes. Whereas in Eastern medicine, it's a little harder. It's hard to study herbs because there's different concentrations. Pharmaceutical companies aren't behind studies, so they're not large prospective randomized controlled trials. So I think the data is not as vigorous or rigorous, but at the end of the day, I find that patients do really, really well when they want to seek full.
Great. That's very informative. Thank you so much, Dr. Wilcox. And we're looking forward to talking to you soon in the next episode. And for those Chinese people, they're really looking forward to contact you. 这些朋友呢，你们都可以去拨打中文咨询电话，可以联系他的助手 Linda， 是206-399-7700，或者是我们来请导播老师放下下面的二维码，好，或者是扫描二维码来咨询。那么在下期节目当中呢 ，Dr. Wilcox 将会为我们带来更多有关于华人夫妻做 IVF 的注意事项，以及呢赴美做试管婴儿或者是代孕等等相关的话题。那我们在下期节目当中呢，将会继续和 Dr. Wilcox 不见不散。Thank you so much for joining us today, and we're looking forward to having you soon in the next episode. Thank you.
Thank you very much, Lee. I appreciate it.
Sure. Bye-bye.
Bye-bye.
Hi, I'm Dr. John Wilcox, Executive Board Member of Jinshin Fertility Group. I'm also the Medical Director here at HRC Fertility. We're very proud of this clinic that we just finished. It's been a 2-year project. We're here in beautiful Pasadena with this gorgeous view from this office. We chose this center because this building is one of the most signature buildings in all of Pasadena. It's right in the center of town. It's easy access for light rail, mass transportation, and all the freeways. So one of the things that's most important to us when we design the center is to make sure that it's friendly, warm, and inviting to the patients. We used a highly respected designer that's worked with us previously on other fertility centers to create an ambiance in our center that is much less clinical and a lot more like a hotel or a high-end spa. So we think she did a fabulous job with the color scheme and all the nuances to create a really positive environment for our patients. What we have here is the waiting room, which is very generous with a large reception. And one of the unique features about this particular clinic is we actually have 2 clinics, one on each side of the waiting room. And this was designed to dramatically reduce waiting times in the center and improve efficiency. This was designed so that we have really mirror images on each side, phlebotomy, ultrasounds, conference rooms, and this allows us to also increase the number of physicians that can work in the same facility. So this is a unique design that the designer helped us develop, which we think is going to dramatically improve our efficiency. All right, here we are. We're in the recovery area in our brand new fertility center. And what you'll notice is not only the high-end fixtures, but we have 7 recovery bays. This allows us to do up to 4 retrievals per hour. This dramatically increases our capacity over their previous IVF center, allowing us tremendous opportunity to grow the center. This is where all the magic happens. As you can see, we've got a state-of-the-art IVF laboratory center that we've developed. With 30 years of knowledge that we put into this center, we spared no expense to create the best for our patients. We're so proud of this IVF laboratory and all of its attributes. We've been fortunate enough to have a team of highly qualified embryologists work with us over the years, and all the technologies have come together to create this very unique, high-quality IVF laboratory for HRC fertility. We are so excited about working in this new environment and looking forward to continue to push the envelope of technology to get the best results for all of our patients.